Okay, so, good morning, everyone. Welcome to the Uncoffee Morning. Guess we'll just get straight into it. Or maybe not. There we go. So, first things first, a wee disclaimer. So, I'm not a medical professional. All information shared during today's presentation is for information purposes only. Should you have any queries regarding bladder pain, interstitial cystitis, then please do contact your local GP or doctor. So, an overview of today's presentation. We'll be looking a wee introduction to myself, to Z-Star Nutrition, a bit of a look into the research, the traffic light system, some beverages, coffee alternatives, which I know is going to be the popular one on today's call, and then I'll look at some recipes as well for some of your own beverages. So, as I said, who am I? So, my name's Peter. I'm 22. I'm from just outside Glasgow in Scotland, and I'm the founder of Z-Star Nutrition. So, what is Z-Star Nutrition? Z-Star Nutrition is it's a company that looks to educate, guide, and provide anybody with no matter their experience level, so from novice to even elite athletes, provide them with some education, some guidance on how to achieve their goals or aspirations, whether it's to become a healthier person, perform better in a sport like an athlete would, or simply your everyday person looking to improve the quality of life. And when we talk about interstitial cystitis and bladder pain syndrome, and living with it, we really want to improve the quality of life that we have, as it's a very debilitating condition. So, just moving on. So the research, so Google research. Google is the first place everybody nowadays more or less will go on to look up a query they may have, whether it's something to do with nutrition and bladder pain syndrome or IC, or whether it's where's the closest post box. It's the first place many people go. But in terms of Googling nutrition for IC and bladder pain, Google research will provide a wide variety of results, often conflicting and contradictory. The research is also not the findings you'll get are also not necessarily research backed, and a lot of the frustration and so the issues that a lot of people get from Google research is this sort of overwhelming wave of information that doesn't seem to match with what the previous thing they've said, the previous thing they read, said, and more often than not, that's where people tend to give up. So, and one of the common things you'll see is Fad Diet. So, Fad Diet is essentially just things that are popular in the current times. So, whether it's the summertime or whether it's winter time, things like this have an effect. What the trends are in the food industry. The next big superfood, as a lot of people like to call them, but there are all sorts of diets, such as gluten-free, dairy-free, plant-based, low-oxalate diet, and the AIP, the autoimmune protocol diet. But looking at what the science says, the research to date is quite limited. We definitely need more around the topic of diet and nutrition, which especially around the topic of how diet can cause flares in BPS and IC. There are some theories in the area, but there's definitely a requirement for further research. Consistency. So currently I am unaware of a large number of studies that consistently link diet and nutrition to IC and BPS, especially around flare and irritation. There are some studies that strongly suggest a relationship between nutrition and IC, with such items as coffee, citrus fruits and juices, spicy foods, chocolate and alcohol. But I believe one of the main issues for the lack of consistency in a lot of the research comes down to how each person is very individual, and how they respond to medication is individual. Not everybody responds well to the same. Not everybody responds the same way to the same medication, and it's the same with diet and nutrition. We can't just have a blanket that works. It'd be wonderful if that was how it worked, but unfortunately, it's not. So a lot of the research is generalized, but it doesn't give us solutions. So some of the theories. So some of the theories that look into the link nutrition and IC flares. The first one comes up is bladder wall damage. So this is where a layer of the bladder wall is damaged, and as a result, substances obtained from consuming food and drink seep into the bladder tissue and cause pain and discomfort. The next one, specific ingredients. So this is where specific ingredients activate sensitive nerve endings in the bladder, causing inflammation, resulting in, again, pain and discomfort. Moving on, we've got IC sufferers having higher pain receptors that react to certain food components. And last but not least, referred pain. So there's a theory that IC sufferers are experiencing referred pain from the large intestine, which passes over into the bladder. But as a whole, from what I've just gone through, there's no clear answer on what we can do. However, there are methods and sort of systems we can put in place to help give us a better understanding for ourselves. And with the average diagnostic time being around 6 years for interstitial cystitis, as soon as we have any symptoms that may lead to that, and as it's a condition diagnosed by elimination, we want to do as much as we can in the time leading up to diagnosis, just to be sure that, you know, if that is the case, then we can do our best and put a plan in place to manage pain, which at the end of the day is what we want, to keep pain down and have a good quality of life. But the best plan is to have a plan. So today I'm going to provide you with a method that allows you to get a better understanding of what food and drink your body is happy with, and the key there is what your body and you as a person are happy with. And that method's called the traffic light system. So the traffic light system is a simple yet effective way to keep on top of nutrition and fluid intake, whilst being mindful of IC, DPS, and flares. So many of you may have heard of the Elimination Diet, where you're given a long list of foods and drinks that you cannot have, and certain things like coffee, alcohol, spicy foods tend to be on that list. The reason that the traffic light system will work quite well, and I would say is probably a wee bit of a better guide than just saying no, because nobody wants to be told what they can't have. They want to be told what they can have. We like to keep things positive. So the traffic light system gives you a more detailed breakdown of what foods that you can and can't have, and it looks at foods that you can potentially have every so often. So the way it works is you'll have 3 lists of foods and 3 lists of food and drink that are green for bladder friendly, items that are generally safe to eat or to drink, which would be your yellow, your amber, and then items that trigger discomfort and should be avoided, especially around flares. And you can do this with all food groups. So you can do beverages, fruits, veg, grains, nuts, dairy, meat, snacks, desserts. You can go even further and look into your beverages, as in types of coffee, which we'll go on to look at. And so types of coffee that might be better for you, and then a big one is especially alcohol, and what alcohol you can and cannot have, and ones that should definitely be avoided. For some people, might be okay for others. So it's a great way of distinguishing what works for you. Okay, so it does require a wee bit of effort in the short term, but once you have the list, it's a simple case of listening to your body and adapting your intake for the next day, the couple of days after you potentially get a flare, or maybe you're moving on from a flare and you're just coming down. So that's the benefit of this system, is you can go on, have your own wee document, you can look at it and you can get a clear picture of, okay, I've had a wee sort of flare here, so what foods am I going to be mindful of this week? And you can even adapt your shopping list for that week. So today's focus is going to be, with the Uncoffee Morning, is going to be on beverages, and it's just an example of what a list could look like for beverages. So you've got your bladder friendly, your try, and your caution. And as previously mentioned, there are theories on foods and diets that can cause triggers and inflammation, as well as foods that can help soothe pain and discomfort. So the items on the bladder friendly list have been highlighted as soothing, especially around time of flare and irritation. But it is important to know for you as an individual what items could be soothing, as well as items that you should maybe have caution and avoid. So just looking through the lists, you'll see, alcohol on the caution, sodas, especially diet. There seems to be a bit of research that would suggest that diet sodas are worse than the full fat, and things like carbonated waters and some vitamin waters. On your try it list, so these are items that you can maybe have in smaller quantities, or once you've been okay for a while, you can maybe sort of try out again, maybe start off smaller quantities, then building into a slightly higher quantity, as long as you're comfortable with it. So things like herbal teas, some low acid coffees, maybe decaf, but yeah, it's all very individual. Low acidic orange, grape, some apple juice, all potentials for being okay around calm times. So, and then on the good side, we've got things like vanilla milkshakes, some herbal teas, non-alcoholic eggnog, and then of course water being the first thing everybody says that we have to have in our diets. But anyway, so looking at coffee alternatives, coffee is a huge part of many people's lives, and being diagnosed with a condition where you're told to avoid coffee at all costs, it can be quite overwhelming and can really have quite an emotional impact on you. There's a huge connection between food, drink, and emotion. A lot of studies into it. So what we want to do is try and keep our motivation high, try and avoid that dip in emotion, and keep our heads held high and really push through. So this is just a list I've put together that we can I'll go through of good coffee alternatives. So the first one there, Dandelion root coffee, a caffeine-free, sweeter, less bitter than your regular coffee. Nutritionally, lots of good levels of iron, zinc, potassium, and calcium, and a good a bunch of vitamins A, B, C, and D. And it is known to contain some probiotics and some antioxidants. So A lot, you'll notice that there's a common theme through a lot of these alternatives, is that they provide other health benefits rather than caffeine-free, and they're not coffee. So moving on, fig-based alternatives. So there's a company called Coffig, which make 100% black mission fig. It's made from 100% black mission figs. It's sugar-free, caffeine-free, and gluten and dairy-free. So barley alternatives, a non-acidic, caffeine-free. Again, so therefore it does not irritate the bladder. It's also been known to help regulate blood sugar, rich in antioxidants, and can aid cholesterol reduction. A brand out of Italy called Orzo Coffee is one that I came across while I was looking through this, but I'm sure that there's a lot more out there that you can purchase. So mushroom alternatives, maybe not something that a lot of people would maybe associate with coffee, or coffee alternatives, but again, provide a less acidic and less caffeinated cup of coffee. So one of the things to note here is that this isn't a caffeine-free necessarily. Depending on the brand you get, caffeine content will vary. Some brands include 4-sigmatic mushroom blend and Raza Bold, but the one I noted was Mud Water, which has 1/7 of the caffeine content than your regular cup of coffee. So moving on, we've got chickpea coffee alternatives. So this is I didn't find too much information on it, but it's definitely out there, and it's a blend that's been around since World War One. But it's yet to make its way into the modern day coffee shop, but it's definitely worth a look into. So Cafe Roma is a full tasting coffee alternative without the caffeine or the tannic acid of coffee beans, and it's made by blending barley, chicory and rye into the one. So Inca is a Polish coffee alternative, been around since around the 1960s, and again utilizes barley, rye, and chicory. Rooibos tea, this is going slightly further afield into South Africa. So this is the meaning, the translation, I believe to be red bush tea, and it's made using the leaves of a shrub from South Africa. It's low in tannins, free from oxalic acid and caffeine. It's also rich in antioxidants, and it's a great alternative for black or green tea. And moving on to looking at teas further, you've got your herbals, your chamomile, and your mint. I believe Paca do quite a range of herbal teas that can be of benefit to people that are looking for an alternative. And then down the bottom there, we've got matcha. So this option, this alternative has one of the higher caffeine levels of all the options spoken about today so far. So caution is recommended when consuming this. But the reason it's been added into today's talk is through some of the research I was doing into maca or matcha, and sort of I see and some patients have taken matcha or alternated their drink choice to matcha from coffee, and have been I've had no issues with it at all. So it would be wrong to dismiss it from the list based on its higher caffeine levels. The interesting thing about this, which I believe maybe why some IC and bladder pain sufferers find matcha to be a bladder friendly alternative, is that it contains a natural substance called L-theanine, which induces a relaxation. So that addition of this natural substance could maybe sort of even out some stress and some inflammation. So moving on, so a wee bit more about beverages. So drinks are commonplace in our life, whether it's a tea break with a meal, or if it's a warm summer's day, so you're looking to cool down a bit, or you're looking to heat up on a cold winter night, a common aspect in everyday life. And as much as this might sound contradictory, so one of the best ways to stay on top of IC and BPS is by staying hydrated. I know there's one of the first things you'd think to do is to reduce fluid intake, so you're then minimizing trips to the bathroom and therefore minimizing pain. But there are some further issues that come with not staying hydrated. So with staying hydrated, we prevent our urine from becoming too concentrated, which as a result may irritate the bladder further, or bring on some inflammation and some irritation. Reducing water and fluid intake to minimize trips is therefore can be counterproductive. And then if it gets taken a bit too far, we've got dehydration, which causes the urine to become darker and more acidic, causing more irritation. But further to that, it can cause constipation, which is something that we don't want to be adding on top of IC or BPS. But we can make sure that we're consuming enough fibre and enough liquids to do that. The recommended guidelines for fibre intake is about 25 grams for female and 35 for men. So it's something to be mindful of. If you're looking up, being hydrated, for the standard adult, it's 6 to 8 glasses a day, which can seem a lot for somebody with IC or bladder pain, and the main thing to be concerned with is just keep track of yourself, how much you take in, what you take in. So keeping a logbook is the best way to do that. It's also great if you keep a logbook with that sort of longer diagnosing time, then you can just hand it over and say, this is what I've been eating, drinking, and this is how it's responded, like how I've responded to it. More often than not, the first thing you'll be asked to do by a doctor, if they suspect IC, is to have a logbook and go and fill one out. So if you've already got it, then you're a step ahead, and you can just get moving along a bit quicker. So making your own, one of the advantages of one of the advantages of making your own drinks is that you know exactly what's in it, and you're not having to look it up too much. So that's one of the disadvantages of buying products that come as made. So if you pick up a carton of orange juice, if you read the ingredients in it, it's not going to say 100% orange. There's other added ingredients into that, which you might be fine to eat an orange, but to consume orange juice might be something that causes a flare, and that could be down to the ingredients that are added into orange juice, just in the manufacturing process. So creating your own drink, a great way to add variety into your diet as well. You can get some smoothies, some infused waters, and they're dead easy to make and to keep hold of. And once you start getting into making your own, you can get creative with it. So once you've got a good list of items that you've got sort of fruits, veg, fluids that your body likes, so you can sort of try it. Then you can start to blend a few of those items together and create your own recipe. And I've got a couple recipes just to show you off the bat. So it doesn't have to be anything crazy. It doesn't have to be anything too out there, but just one of these things that you can definitely add into your life to add that bit of security in knowing what exactly you're drinking, and being positive that it's something that is good for you through what your own study has shown you. So the first one there is a blueberry burst. So nice and simple, a handful of blueberries, a banana, scoop of vanilla ice cream, and 200 ml of some cold milk. Blend it all together, and you've got yourself a nice wee smoothie there. I will say, on terms of quantities of things of items that you're going to put into smoothies, for example, bananas tend to be on the list of caution, or do be wary of. So instead of adding a whole banana, you could do a half or even a quarter, and you can see that once you start adding in more and more, you can get a better understanding of what your body does and doesn't like. But next one, we've got a pumpkin pulse. So this is simply 200 ml of coconut water, 75 to 100 grams of cooked pumpkin, and then 15 grams of some clear honey, or about a tablespoon of clear honey. The advantage of this is it's good for the immune system, and it's also good for attacking bacteria that can cause UTIs. I've looked into a few similar drinks that are looking at the use of pumpkin, coconut water, clear honey, and a few other items, and having it sort of pre-bed or your last drink of the day could be good. But yeah, again, it all comes down to the individual. But so you can see from 3 simple ingredients that you've highlighted to be good for you and safe for you to consume, you can create a whole other drink. So yep, it's as simple as that. But again, there's a bit of effort required in creating this list. But for the sake of a couple of hours of focusing on what food and drink we do and don't agree with, we can save ourselves a lot of pain and in the long run, especially with the being uncurable. We're not going to get a magic remedy, but we can definitely manage pain, and we can do that by managing our food and our drink. And that's us for this morning. So thank you for listening. I just put up my contact details. So if you get any questions on today's presentation, please feel free to drop me an email. I'm also on Facebook and on Instagram. There's currently a website in the making, but once that is up and running, the presentation will be on there to rewatch, and there'll be lots of good research-backed information that you can make yourself to apply into your life. Thank you, and have a good day.